and welcome everyone to our Industry Insiders webinar series, which is brought to you all through the Office of Alumni Engagement at the college. And my name is Pam Persichetti. I am a member of the Alumni Engagement team. So again, thank you for joining us and taking some time out to listen into today's presentation of how business thinking can improve lives with our School of Business Dean and faculty members. Before I introduce Dean Jervis, I will just say that we will have a Q&A at the conclusion of the presentation. So if at any time you have a question to submit, you can use the Q&A or the chat feature, and I will facilitate those questions at the conclusion of the presentation. So I will introduce Dean Jervis, and I believe she will then introduce our faculty members, but thank you all for joining us and being a part of this. This webinar was brought to our office through Dean Jervis through some conversations she had with, I believe, some alumni and maybe some other staff as well. So thank you for bringing this idea, and I'm glad we could put it together with such a wonderful panel that we have today. Dean Jervis joined TCNJ just this past July, and she comes to us from the University of Rhode Island, where she most recently served as Director of Graduate Healthcare Management Program and also a Professor of Accounting. Previously, she served as Interim Dean and Department Chair, also at URI. As a first-generation college student, she earned her bachelor's in mathematics and an elementary education certification from Rhode Island College. She then went on to earn her master's in accounting at URI, followed by a doctorate from the University of Connecticut. She's also had several publications in accounting, healthcare, and educational journals. And we're very happy to have her here at TCNJ, and already has made a really big impact on the School of Business in a very short amount of time. So we're excited to have you with us going forward as well. Dean Jervis, thanks.
Thanks, Pam. Welcome to everybody. We're so happy to have you here today. So you heard from my bio, I am an interdisciplinary thinker, and the people on the panel are as well. So I want to ask, what do you think about when you think about business? When I ask people, they name the business disciplines: accounting, finance, management, marketing, you know, the usual. Others will say, we'll talk about money, earning money, making money, raising money, and so forth. That's what we think about when we think about business. But suppose we tell you that business can do much more. Somebody's academic discipline is simply the lens through which they view the world. It doesn't describe the broader impact of that discipline. Actually, if you think about it, rather than all about money, business provides a way to allocate scarce resources in the economy, amongst other things. In the next hour, we aim to perhaps change your perceptions and to highlight how business thinking can improve lives. Business underlies almost every discipline in some way. Good business practices assist in the efficient management of resources and the quality of services in fields such as engineering, pharmacy, healthcare, and nonprofit organizations, symphonies, museums, and soup kitchens, and governmental agencies that could not run successfully and productively without sound business knowledge. We have essentially three forms of business organization: for-profit, nonprofit, and governmental. Business concepts and tools are used in all three forms, which you will hear about from our panelists. For-profits obviously have the operational goal of earning money by providing goods and services to customers. Nonprofits have the operational goal of providing goods and services to a targeted smaller group of individuals who need that particular thing. There's no intention there for them to earn money. Actually, nonprofits is somewhat of a misnomer in that nonprofit organizations do have to run in the black in order to operate successfully. It simply just means that founders cannot take any of the earnings out in the form of dividends. And then finally, government supply public goods to all, whether it's public education, public safety, what anybody would want. If you think about the clean air and the clean water initiatives that started several decades ago, those actually started as nonprofit organizations, and then when raised to public awareness became governmental obligations. Our panelists will offer examples from how business impacts and improves lives, Just a quick story for you about supply chain, which just amazed me. I was at a little deli in North Carolina with a group of students, and everybody said to go there to get your lunch. And we got there and the line had to be 50 or 100 people long. We sort of had a little panic attack about it. Somebody came along with a little pad of paper. They took your order, and I thought, oh, we're never going to get out of here. We're never going to eat. We got to the front of the line, said your number, you paid your money, and they handed you your lunch. It was an absolutely wonderful example of supply chain in action. So our panelists are going to tell you all about this. Our first panelist is from economics, and she's going to describe how economic thinking influences labor and healthcare. Our second is from supply chain management. We'll have some inkling, we all have some inkling about how supply chain has been such a hot topic during this pandemic as we've searched for goods in the grocery store and now vaccines. And then our third panelist is from the innovation field. He'll describe how innovation thinking influences nonprofits, the environment, and even the government of Trenton. So thanks for coming today. Each panelist will speak approximately 10 minutes. We'll follow that by a Q&A. I will hold up a 2-minute warning for folks. And so let me introduce Dr. Broderson, Dr. Broderson, who was our first panelist. She is an associate professor in the Department of Economics. She received her PhD from the University of Illinois at Chicago. She's been on our faculty since 2008, teaching principles of microeconomics, principles of macroeconomics, health economics, labor economics, senior thesis, and in the freshman seminar experience. Her research interests include behavioral economics, demography, and the economics of religion. So, Dr. Broderson.
Let me unmute myself. It took a few tries. Hi, everyone. Great to have you here. I'm delighted to be part of our panel. And let me try to share my screen. All right. Can you see it all right? Okay, and I can see everyone on the side. That's wonderful. My assigned topic is to give some examples of how economics impacts our lives. And I thought long and hard about it, and I came up with 3 main examples. So my discussion is following the following outline. I would first introduce a couple of concepts in economics and give us a big picture overview of what economics is about. Then I'm going to give an example in labor economics, health economics, and an example from my own research. All right, so what is economics? And this probably brings you back to your college days. What is the definition of economics? It studies the efficient allocation of scarce resources. So we talk about efficient allocation, we don't waste anything, and scarce resources. When we say resources in economics, we're referring to the 3 main resources: labor, so workers, physical capital, such as buildings, equipment, machinery, and land and natural resources. And those are scarce. So scarcity is a big topic we talk about in economics, and that's one of the reasons why economics exists, because we have scarce resources and unlimited ones, and we have to make decisions. So we have limited resources of goods, services, time, money, opportunities. And we often talk about the concept of opportunity cost, which is the value of the next best alternative or what you give up to do something. So for us all to be here in this seminar, we're giving up spending time doing something else, where it's sleeping or working or reading, walking outside in this beautiful day today, etc. All right, so let's take a look at what economics covers. So when saying economics, people often think, oh, it's about money. And economics is not only about money, it covers a lot more. So what I have here is the American Economic Association Journal of Economic Literature classification codes of economics, so various fields and general categories in economics. So we start with general economics and teaching, history of economic thought, So you can see microeconomics and macroeconomics, the two major fields. And then we have sort of the electives. And some of those electives are labor and demographic economics under J, and then health, education, and welfare, I. So health economics actually used to be a branch of labor economics, and then it got so big that it branched off on its own and combined with education and welfare. And as you can see, there are a lot of words here: finance, public economics, education, demographic economics, law, history. Economics steps on the toes of many other fields, which makes it lots of fun because you can pursue interests in pretty much any area of life you're interested in. And we have this category Z, other special topics, and I pulled out, so you can click on any of those and you have a bigger menu drops out to see what is included under that category. So under other special topics, we see cultural economics, economic sociology, anthropology, the economics of religion, Z12, sports economics, which has been a popular subject in colleges recently. So what these letters and numbers represent, if you look at a journal article, oftentimes under the abstract, there is a series of letters and numbers, and there are these codes, JEL codes, classifying the main ideas, the main topics that are covered in that paper. So for example, a Z12 would be the economics of religion, etc. Okay, so let's take a look now at, scroll down. And the first example in labor economics, and it will be on discrimination. So you may have seen or heard of the books Free Economics. It became a #1 New York Times bestseller, very popular read at the airport. And other similar books such as The Undercover Economist, The Armchair Economist. So for example, in Free Economics, it covers topics like why are drug dealers making less money than their moms? Why do they live with their mothers? And other very fascinating reads. And one would say, is this really part of economics? And yes, it is. And how did all that start? Sort of these pop economic topics, pop culture economics, I guess we can say. Gary Becker is probably the father or one of the main contributors to this branch of economics, where we really study behavior economics in various aspects of everyday life. So Gary Becker received the Nobel Prize in Economics in 1992 for having extended the domain of microeconomic analysis to a wide range of human behavior and interaction, including non-market behavior. So he took the tools of microeconomics and he applied it to topics such as the economics of marriage, how do people choose a spouse, of household division of labor, who is working, who is not working, what are decisions the household makes, how many children to have. He also looked at crime, and probably one of the very first topics he touched on was the economics of discrimination, which was actually part of his dissertation thesis. He graduated at the University of Chicago, and he published it later on as a book. So here is the second edition. It came out in 1972. But this is sort of the new trend in economics that he is one of the sort of the main fathers of that trend, I can say, where we are studying non-market behavior in economics. And he's developing some very interesting economic models to explain people's behavior, and here in particular, the economics of discrimination. And by the way, Milton Friedman called Gary Becker the greatest social scientist who has lived and worked in the last half century. And he is probably my favorite economist. All right, so let's take a look at what's in that little book, The Economics of Discrimination. And I have to say, it was very fun for me to prepare for this seminar. And I started out with this like elaborate economic model, and I'm like, oh, I don't know if everyone can follow this slide. So I ended up with very big picture sort of from the sky down picture, very high level. And I have some extra slides. I'll be happy to elaborate if people are interested to go into more depth and understand better what is really happening. In his discrimination model, Becker starts out with assumptions. Economists love making assumptions, and that's very important because we have so many things are happening all the time, so many changes simultaneously are occurring that in order to study the behavior or the phenomenon that we're interested in, we need to kind of assume everything else away and focus on this. Oh my gosh, I have a 2-minute warning. Okay, focus on this one main topic. So, he assumes that people have a taste for discrimination, and we have two groups that are equally productive, but there may be some discrimination going on. And the discrimination can be either on part of employers, who they hire, employees, and they discriminate who they work with, and customers, they may discriminate who they buy things from. In a nutshell, the model predicts what happens in terms of wages between the two groups, whether we're going to have a segregated force that only one group will be hired, and what happens with profits of the company. And given my warning, I'm going to skip on. The second example that I wanted to talk about, I'd like to talk about, I hope I'll have a couple extra minutes, is on health economics. And I read this book, it's based on this book, Compassionomics, which I find fascinating. And it looks at sort of the big question that is posed is patients in the US healthcare system often feel they're treated with the lack of empathy. And doctors and nurses have tragically high levels of burnout. And could fixing the first problem solve the second? And the bottom line is that yes, compassion, exercising more compassion improves patient outcomes, increases hospital revenues, decreases hospital costs. Healthcare costs are 18% of the GDP of our country, and that's a really tall share, higher than any other country in the world. In fact, our health economy is as big as the German economy. And finally, the last outcome is that compassion actually results in decreased burnout for providers, for physicians and nurses. Compassion is an emotional response to another's pain or suffering involving an authentic desire to help. So in this book, we have detailed description of how everything works out, the physiological and psychological mechanisms that compassion improves outcomes. Why is compassion so important? Actually, when patients were surveyed, what are the extremely important traits in their doctors? 85% said yes to being treated with dignity and respect. So in essence, they were referring to compassion. And other things that we may think, oh, that may be the number one cited, the best medical, that the doctor comes from the best medical school. 27% of patients only said that, or the doctor has a lot of experience, only 58% of patients said that. So compassion was really, really high. So when studying compassion, it's like a mushy topic. How do you measure compassion? And that was a big challenge. The researchers found that having basically patient-centered care, such as kindness, empathy, warmth, other survey, 10-question care measure survey, were some ways to track that. And they found that exercising compassion did not actually decrease time spent with the patient on discussing treatment and other topics. It only took 40 seconds to exercise patience, and it had this amazing impact on patients. They recovered faster, they followed the protocol of taking their medication, which actually cut down additional costs further down the road. Furthermore, hospitals had a higher ranking from patients, and when they do that, they get higher reimbursement rates from the Centers for Medicare and Medicaid Services, and physician burnout decreases. So this seems to be a win-win situation, solving all problems.
So with that, we're going to now turn to supply chain. So compassion, economics influences compassion in healthcare. Thank you, Donka.
Thank
So
you.
the next speaker is Dr. Sheng Bingwam. He is an associate professor in supply chain management, received his PhD from Rutgers University. His teaching interests include operations management, supply chain management, and enterprise resource planning. His primary research interests lie in supply chain operations modeling, humanitarian operations management, and last mile system design, which he's going to talk about today. Dr. Wang.
Thank you so much, Kathryn. Hello, everyone. I'm very excited to be here to share with you some of my experiences in supply chain management. So today I'm going to talk about two things, basically. One is I'm going to share with you some examples of good, successful supply chain management, companies and organizations. And then I'll share with you one of the ongoing research that I'm working on. And probably I'm going to need your help for some of the part of the research. So let me go ahead and share my screen with you. So when I prepare for this webinar, the first thing that came to my mind about supply chain management was two retailers. They're basically, I would say largest retailers in the world. So Walmart is the largest offline retailers, and Amazon is the Walmart's online competitor. So they are representative retailers and companies in who are doing great supply chain management, and also on the other hand, their supply chain are totally different. So we want to take a quick look at the their supply chain. So let's take a look at the Amazon supply chain first. So we all know Amazon is an online retailer, and they in their supply chain they don't have retail stores. So this absolutely saved them a lot of money in terms of operating cost. So right now, Amazon has like more than 150 warehouses and distribution centers, in the United States, and New Jersey has been ranked as number 3 in terms of the number of distribution centers. So, as residents in New Jersey, I would say, most of us absolutely, at some time of our life, we already, shopped from Amazon, and if you're a New Jersey resident, you may enjoy the same day delivery service, really, because they got a good number of warehouses and distribution centers. So this is one of the reasons that Amazon can lower the cost, and their price for the items are very competitive. Okay, so another thing for the success of Amazon is their delivery network. Okay, so the online retailing requires a high level of delivery capability. So Amazon did really well in this category. So the items are shipped out of their warehouse. They have different third-party carriers that can handle their delivery and distribution. So most recently, Amazon purchased their own fleet that can help Amazon lower their delivery cost like further. So that's why you can always see some holiday season you will enjoy like pretty amazing low price for some of the items from Amazon. Okay, so that's for Amazon supply chain. If we look at the Walmart supply chain, they have retail stores, right? So Walmart is very similar to Costco and the other like major grocery stores. So their supply chain is different. They don't have a lot of warehouses in the country, but they do have retail stores. The retail store normally will will keep like a high level of inventory. So this will help them to meet customer demand in a timely manner. And in the same time, Walmart has everyday low price strategy. So that is pretty amazing as well, because they can pass their low supply chain cost directly to their customers. But the question is, they have different supply chain. But what about the strategy of Walmart? It's clearly different from Amazon's strategy, right? So Walmart's strategy is, they implemented a lot of, like physical supply chain management techniques. For example, one of them is vendor managed inventory. So in this case, they have their vendor and suppliers pay for their inventory. So this will lower their inventory cost and also improve their inventory turnover rate. So this will meet customer demand and also can offer everyday low price. So that's one of the reasons for their superior supply chain management. Okay, so we also have some other successful stories other than these two big companies. We also have Toyota, Apple, and McDonald's. They're also doing great because of their good supply chain management. So we can tell the impact of this supply chain and operations management. This will really help firms to be popular, to make money, and also they can help lower the cost for people, for the normal residents. So that's the good, the positive impact of supply chain. So you may wonder, hey, what if my supply chain is not working well? Does that have any impact on my daily life? Of course, right? So if you look at the recent COVID-19 cases, all right? So during the early stage of COVID-19, like last year, probably early April or late March, I think everybody experienced the same thing. When you went to the supermarket, you saw everything was like in shortage, right? So like drinking water, sanitation, toilet papers. That was because there was a sudden change in the demand, right? So we got a lot of panic orders due to COVID-19, due to the pandemic, and then the supply chain couldn't respond to the sudden change. All right, so that's one of the reasons we see this is, I wouldn't call this a poor supply chain management, but it absolutely, it can show the negative impact of a less agile supply chain, okay? And then on the right-hand side, that picture is more recent. That's about, we're talking about the vaccine delivery for COVID-19. And then, again, at the early stage, like last January, like last month, well, the United States experienced like delays in the delivery, and we struggle in the delivery of vaccine. But right now, the supply chain has been improved, right? So really, because we have already got that deep freeze delivery device and tools for the distribution of the vaccines. So you can tell the impact of supply chain and delivery and transportation. So it can impact everything, our daily life, and as well as the profit of the companies. All right, so that's a general, a brief impact of the supply chain management. And next thing I want to share with you is one of my ongoing research project, but it's more related to transportation. Okay, so that's something I'm very excited about. So it's called Last Mile, First Mile project. So last mile, first mile, really, they're related to, for example, I think most of us have sometime, we have to take like NJ Transit or any public transportation, right? But what really, bothers us is, how do you get to the train station or the bus stop, right? So normally, a lot of people choose to walk, or take some bicycle, or you can park it somewhere near the train station, right? And then this is for first mile. And last mile, same thing. When you when you get off the train or bus, right, or the public transportation, how do you get to your office? How do you get to the destination, right? There's also a last mile there. All right, so I'm going to finish in 2 minutes. So the current situation is people use paratransit. So that's like small shuttle bus and so forth to connect people from their home to the bus station or train station, and then also connect people from the train station to their destination. However, this way is economically and environmentally very inefficient, because you're you know, a lot of it's been like a waste of time when you wait for the surveys, right? And sometimes there's scheduling issues, and also we have, you know, environmental pollution. What we propose to replace this, this is also, you know, aligned with the proposal from the government of New Jersey, state of New Jersey. So we propose to replace the current last mile solution using automated driverless shuttle bus or smart cars to help, take people from their home to their destination, or to the bus station, or to the train station. All right. So let me show you how we use that. For example, if you have a need to go from your house to the train station, and then you can go to the app, right? So it's like an Uber, and then you can order that, right? And then you will see in 3 minutes the shuttle bus will be at home. But the bus is electric vehicle and it's autonomous. There's no driver. All right. And then, first mile, the bus will take you to the bus station, and then you can take public transit or train or whatever. And then finally, you want to get off the train, you can still take this last mile bus, shuttle bus to your destination. So this will make the whole system seamless and very efficient. Okay, so right now we are in the process of collecting data from different New Jersey residents. So I hope I can get some help from you guys. All right, thank you so much.
Thank you. That was excellent. I found myself stuck in Washington, D.C., a mile to go with suitcase, bags, and everything else, and no way to get there. So last but not least, we have Dr. Kevin Michels, who is a professor and founding director of the School of Business Center for Innovation and Ethics. His current research explores value, ethics, and technology, and how they work together to make innovation possible. He teaches innovation in the undergraduate and MBA programs, as well as courses in ethics and law. In 2017, he was named by Poets and Quants as one of the top 40 undergraduate business professors in the nation. So, Kevin.
Thank you, Kathryn. I enjoy being a part of this panel, and thank you for coming up with this intriguing topic for this panel. I think it's really compelling to think about how business plays out in so many sectors, and these are pretty interesting examples so far. Let me begin with a couple of stories. Stories are always fun because we can think about them, but they're also kind of engaging in their own right before we even go into analytical mode. So let's just think about two situations. I want to tell you a couple of stories that are about a century apart. Begin in the 1870s. Imagine yourself in Paris in a hospital. There's a Paris obstetrician by the name of Stéphane Tarnier, who was working in the maternity ward, what we'd call it today, and deeply troubled by the death rate amongst premature infants. You know, if you're born early in a hospital or anywhere in the 1870s, your odds were not very good of surviving. And it's a tragic, it's a horrifying story. And you can imagine what his life was like dealing with parents who were not going to be leaving the hospital with their child. One day, Tarnier is walking through the Paris Zoo when he happens upon a device. It's kind of warming things up, and there are eggs in there. And there's some liquid underneath, and that seems to be at work doing something. And there's a heating device under it. And he kind of studies it a little bit more, and he realizes it's a kind of an egg warming device for bird eggs. And inspiration strikes. And he wanders over to the fellow at the zoo that built this thing, and he says, "Could you build the equivalent of this for me for the hospital?" And in that moment, the incubator was born. The French were very much statistically oriented in the medical profession, and it took him a while to make the case internally that this was changing everything. But within a short amount of time, he had the statistics in hand to show that the mortality rate was halved. Your chances were twice as great now of going home from the hospital. And this was just with the initial iteration of this device. And we now know how many millions of lives, premature infants' lives are, probably some of us in the audience, right, have had the benefit of this incubator device. And it saves so many lives and full lives, right? Because if you save a life at the beginning, it's this entire rich journey ahead that you've made possible. So it's just an extraordinary story. So that's an example of innovation. And now let's go back to business, right? We're here in a business setting talking about how expansive it is, but let's just talk about a simple business example here. A fellow named John Shepard Barron in the 1960s. This is an interesting story, right? He arrives at a bank in the 60s. And if you recall that time, I kind of remember it, into the 70s, where if you showed up late on a Saturday afternoon, the bank was closed. And you'd kind of look through the glass and they'd wave back at you and say, sorry, you can't get your money. And that would be it for the weekend, right? And if you didn't get the timing right, you just did without. And most of us understood that's the way the world works. Shepard Barron said, no. This may be the way the world works, but it's not the way it ought to work. And he found himself pondering how it could be that he can't get access to his money when he wants. And he found himself thinking about it in all places while he was sitting in the bathtub one night. And what he found himself thinking about was, is there a way to get money to people when nobody's around? And he said, what kind of does that? What kind of does something like that? And he thought of the candy bar machine. I said, I wonder if we could make a candy bar machine deliver cash. And in that moment, the inspiration for the automated teller machine was born. So both of these are examples of innovation. They're both from completely different sectors. So we should understand right off the bat that innovation is essentially a tool that can transform any space. And that's really the key. If we think of it as just a business tool, we're just limiting its powers. In fact, often when we innovate, what we discover is that the questions about how to fund it and how it should be rolled out, emerge, and need to be resolved in light of what it is we've created. Is it a nonprofit? Is it a social innovation? Is it a business innovation? Those kinds of questions are almost secondary because innovation is ultimately focused on creating and delivering applied value to beneficiaries. And by value, applied value, we mean the things we favor in the world, the things we deeply care about. It also needs to be ethical, right? Because ethical and value, they're actually separate concepts. If you press me on that, I would probably tell you far too much about how they differ. But the important point is that we need to do both because innovation is ultimately change that's designed to make the world better. You don't make the world better unless you deliver value into it. Value is this vast array of things that we humans favor. They also need to be things we favor with justification, with reason. So there's some sense that it's not just approval. It's some kind of fitting or just approval that makes sense. And it needs to be ethical because if we're creating value for some and harming others, we're not making the world a better place. And so the question, of course, is how do you do it? How do you make innovation happen? I've spent a lot of my last few years reflecting deeply on that, developing kind of a system and a systematic way of understanding how you think across domains to make innovation happen. I'll just sketch out a few notes from my thinking, and I've been sharing these ideas with students through the years. That the underlying premise in my innovation classes, I want you to question with me the widespread assumption that you can't teach creativity. And I invite my students into that question at the beginning, and I ask them at the end, do you think we're better at it for having thought about it systematically and how it might work? So a few pathways here. One, the first thing you do is you select a domain that you want to innovate. You define the domain. It could be a product, service, industry, region, enterprise, whatever you want to reflect on. You identify the beneficiaries in that domain. Who does it serve? In what way, shape, or form? Number two, you question the domain. I've developed a term I call the suboptimal state, which is a gap between is and ought in the world. It's not a gap between the ideal, but optimality focuses on what's feasible or what's possible. And shorthand for that is what I call an SOS. So a suboptimal state is a gap in a space on either the values we deliver in the space are simply not being delivered well enough. What is it we care about in a space? Is there a substantial gap between what we're doing and what we could be doing to deliver them better? And another way to think about domains to find problems is to ask whether there's a new value you could deliver into a space, right? We don't assume that what it's doing now covers the full range of what it could do in terms of creating benefits for humans or the environment or whatever, or animals, whoever you deem the beneficiaries. The point is that requires you to think expansively about the space you're in. So if you're at a university setting, you might ask, okay, listen, we're doing a lot of things well, but what other value could we serve? For example, TCNJ could ask, and I'm sure there are conversations, could we serve another portion of the population? How about adults who are working who weren't able to get, time to go to college and are really talented and need that opportunity? And could we accommodate them, right? That would be a new value we might want to serve, right? To just kind of offer an example here. After you find your question or your suboptimal state, then you study it. Study the history, the causes, the context, and you look at prior efforts to solve it. Once you've done that, then you want to identify what I call the solution conditions, which are those things that need to be delivered into the world in order to solve your problem. Once you have those solution conditions, you're set to start looking across domains, other domains, well beyond your specialty. And this is why we are in an interdisciplinary conversation today. This is why innovation is the ultimate interdisciplinary pursuit, because if it could be solved with expertise from your own domain, it's likely not going to be a groundbreaking advance. There's a good possibility it's already been addressed, but maybe it can happen with your tools. The only problem is you've just limited yourself to one domain out of about 1,000 that might bear on driving a solution. So from a matter of just pure probability, the likelihood is manifoldly greater if you are able to search far and wide for solutions. So the challenge is, how do you do that? And the way you do it is with analogy. You build analogies based on those solution conditions I've described earlier. You jump across domains and ask, are there other domains where something that's similar in one critical way is going on, right? An analogy, in my way of thinking, is just similarity despite difference. So how is a candy bar machine like a vending machine or like an ATM? It's not very like it. It delivers candy, not money, right? It doesn't dispense money, it dispenses candy. We could distinguish it all day long. But in one critical way, it's similar. It allows a transaction to occur without a human being present. And that's all we need to inspire a solution in another space. How is a baby chick incubator like a incubator in the hospital? The last time I checked, baby chicks and bird eggs are pretty different than human infants, right? We get that, but notice the similarity here. It's replicating in some sense the conditions of the child's setting before birth, the womb, right? The warmth, the tools to create a sterile environment and so on. All of that is what matters. That's the analogy. It's the ability to discern the essence and move it across domains. So, and perfect timing here, because I want to chat with you now about what we're doing now beyond the business setting. I have a couple of classes at work at the college now where we're focusing on innovating in the Trenton space. One of my classes is really trying to build out this idea of interdisciplinarity, right? If we work across domains, if we work across disciplines, we have a much greater chance of affecting change. So my innovation class is working with an electrical engineering class to use the Internet of Things, these small sensors that can gather information and replicate it, produce it, move things, report data, to start thinking about how to innovate cities. I have another group that's working even more expansively and thinking about Trenton more, beyond a particular tool. But just this little device called the Internet of Things, a little tiny device that came out of the electrical engineering world and digital automation world, can enable environmental monitoring, water monitoring, traffic monitoring, and analysis. It can allow you to put a device in a garbage can to tell the city whether it's full. And if you've got 1,500 of them around the city, wouldn't it be nice if you could get a real-time report on which one is full? Because a full garbage can means trash all over the ground, typically, right? If our experience is apt here. You can even manage the lighting in a city, which has a lot to do with safety, right? When is it on? When is it off? Is it on when people are present? Are you sure that it's on? Are you not wasting electricity, but making sure it's on when people are around? The city of Bristol in London just put a set of IoT devices on a bridge because people were either jumping or falling off, depending on their preference, some for amusement, some by accident. Within 3 hours after they put the device up, they got an emergency report from the sensor, dispatched somebody and saved a life. So you can see the power of these tools to affect change in every environment. It's not just business, but it is business, but it's also the social environment, the educational environment. It's the environment itself, as I mentioned of some of those examples. And it's frankly, it's every domain that you care about, profit, nonprofit, wherever we humans, favor and care about something of importance or value in a space, that's an opportunity for innovation to deliver valuable change and make it better. So thanks, Kathryn. Appreciate it.
Thank you very much. So I think we have some of our own questions if the audience cannot think of any, but I'm sure that you can. So we welcome you to, let's see, I can look through.
We did just have a question come through.
Okay, yes. So here's the question. If business decisions and policies are made based on research, and research is only possible through the collection of data, how do we combat bias in research outcomes and ultimately discriminatory practices and policies when the data inputted contains a lot of bias? And so that's sort of a data question. So I don't know, does somebody want to take a stab at that? Shengbin, would you like to say something?
I think Donka should be the expert in this data question.
Okay, Donka?
I'll be happy to start. Okay, so yeah, economics deals with large data and analysis of large data, and we care about whether we have a causal or causation, a correlation or a causal relationship. So I think that's where Shengbin was going at. Yes, so what happens if we have bad data in, bad research analysis out? And that's a very good point. So we need to be very careful about the research design. And the example that I gave with compassion is a good example for that, because it's a mushy topic. How do you measure compassion? And there are many different aspects of compassion. So maybe you need to have some kind of a vector variable that comprises of, a scale of 10 questions on a scale from 1 to 10, or however you want to define it more accurately to have a better understanding rather than just have or not have, yes or no. We can also have self-selection of people who respond to a survey or use a program, and that's the data that we observe, and that's what we collect. So there are statistical methods to deal with potential selection bias, omitted variable bias if we're missing some important variables in the analysis.
Okay.
So so there are various statistical ways to manage potential problems with the data. But research design is probably the most important thing, and we have to think very carefully what are the groups that we want to study, what is the question we want to study, and the best way to collect the data. Is it representative of the whole population, or is it just a certain group of people that we're getting accurate data for, but not representative of the whole country? So there are many issues.
Thank you. That excellent answer. That explains, I think, very well. So the next one, Professor Michels, I apologize because I'm not familiar with the ongoing research your students are doing. Are they working with the inhabitants of the city to implement these solutions?
Well, right now we're working very hard to study the domain and learn about it, right? As I mentioned, that's kind of the first step on the innovation journey. So in my combined courses, we've had the mayor of Trenton in, the Secretary of State of Trenton, one of the mayor's aides who's a specialist in policy issues. We've spent a great deal of time thinking about the domain and studying the various reports that have been produced about the city. So yeah, we're only 3 weeks in, and you can see we've already heard from a lot of folks, and we've been reading and studying extensively, but that's just the beginning. We want to hear from more and farther and wider, and what I call the beneficiaries of the space, to speak kind of generally. We want to hear about the constituents, the citizens, and so on. So yeah, we're learning as far and as wide as we can and as quickly as we can.
Thank you.
There was also a question submitted privately. If you don't mind, I'll read that one for Dr. Wang. It said, what is the estimated timeline for a project like the last mile to launch in New Jersey?
That's a good question. I think the government of state of New Jersey, I think last year they just proposed to offer this automated vehicle replacement for the current public transportation. I think for my research, we're gonna absolutely finish like this year. We are in the process of collecting data. Basically, it's gonna be a survey data to see the opinions for the adoptions of autonomous vehicles from the New Jersey residents. But for actually launch the autonomous vehicle, I think the timeline would be like in 5 years. It's going to be a long run.
Thank you.
If I may just add, there's some interesting conversations going on in the cities, including Trenton, regarding solving some of the transportation issues for the residents using these very tools you described, Shengbin. So it also has these interesting social innovation possibilities as well. It's very exciting.
Thank you. Thank you.
Yeah.
I should mention that Shengbin got the New Jersey Insurance Manufacturers Association Award for this particular research last year. And so,
thank you.
Excellent project. Does anybody see any others that came in? All right, so I guess that I can ask a question then. What do you think is going to happen in your particular discipline in the next 5 to 10 years with respect to how that's going to impact the lives of people going forward? So Donka, do you want to start?
One sec. Yeah. So right now, I guess the big challenge is what is happening with coronavirus and the lockdowns and all of that. That's one. And the other big change, I think, that's kind of always up in the area of economics is bigger data sets, finer data are continuing to be just handled better and better. We have finer and finer analysis. So with the coronavirus, it's very important to collect the right kind of data that correctly captures what is happening, and that kind of pertains again to the question that Michael asked. The data, we had a model predicting deaths that was revised majorly later on. So if we have a bad model predicting initially, then everything else that we're basing off of it is going to be also have to be revised. And that's oftentimes the nature of how data works. For example, agencies like the Bureau of Labor Statistics, the Bureau of Economic Analysis, they have preliminary estimates, revised estimates, estimates revised 5 years later. So that's constantly a matter of change. I guess another thing that as I was preparing for this seminar, I thought that would be really, really neat to see happening in real life. As I was working on that, developing that example on compassionomics and compassion in our country. What if we have the same issue now, not just looking at hospitals, but on a large scale with people being clogged down, not socializing as much. I know it's, we socialize on Zoom, but it is different in person. And when people are in the street, they don't make eye contact as much as in the old days before coronavirus. So what if we have a compassion crisis on a large scale, which can lead to a burnout? Which not having the compassion can lead to a burnout. So if we were to practice more compassion, maybe that is going to result in just stronger emotional support and interactions with others, and we'll be able to get through this stronger and come out better. So that's something that I feel could be a big change.
So behavioral economics informs,
from looking
informs
perspective.
Yes, mental health issues and so forth going forward. That's excellent. That's an excellent thought. Shengbin, would you like to add to that?
Yeah, I think two of the things might change in the next 5 to 10 years. One of them is the globalization. I think in the past 5 years, globalization like has been slowed down due to the previous president policy. So we didn't do like as many businesses with the other countries as before. But with the new president, I think globalization will continue to prosper, and we're gonna probably expand the business, and continue doing business with the other countries and companies. And that's one of the things. The second one I think is the online retailing. So it's gonna be a trend. So we have already seen in the past year, during COVID-19, the online retailing, online shopping has been like, has become a major shopping like way, right? So it has changed, the way of shopping for the people. So I think it's gonna be, popular in the next 5 to 10 years. So with more and more online retailers.
Thank you. And then Kevin. Mute.
Apologies. So the interesting thing about asking me about the future of a discipline is it's just the very premise of innovation as a discipline is one of the most exciting aspects of all. Up until very recently, not too many colleges were even offering courses in innovation. And we were among the first here. I think it's fair to say, not the first, but among the early movers in this space. It is now increasingly being understood as a discipline of its own, innovation. And we're those of us who have been thinking about this for years are now finally, kind of, let's say, heartened to see that the academic piece is moving in every direction from all sides, from the business side, from the technology side, from the social innovation side. I happen to think some of these various adjectives are unnecessary, and we need to see the whole discipline holistically. But more importantly, now in the commercial space, the acknowledgement could not be any greater. I mean, company after company now has chief innovation officers. We have a couple of 2 or 3 innovation experts that I've been working with in the last year who've been visiting my classes in various forms or teaching here on the campus, to kind of join us as, in class to give kind of practitioner experience. And they have, a story to tell about the power and importance of their own companies making innovation absolutely central. They know that, they don't want to become the next Blockbuster, right? And that fear or opportunity, depending on how you want to think about it, is what's driving a very deep long-term commitment to transforming the way organizations think. They don't want to just do the same thing well. They want to do the new and best great thing that's going to transform their particular space.
Thank you. So I think we're just about at the end of our time. Is that true, Pam?
That is true. This was perfectly timed out.
So if I can just say, I would like to thank all the panelists. Now everybody here knows why I am so excited to be part of TCNJ and the excellent people that all work here. And hopefully, thank you to all of the participants that came on today to listen to this. And I hope we have changed some minds about how business thinking can truly improve your life. So thank you.
And thank you, Dean Jervis. Thank you, all of the panelists. I just want to echo what Kathryn mentioned. Thank you for sharing all of your research and enabling us all to kind of think outside the typical context of business. So we appreciate it. Thank you. Everyone stay safe, and hopefully our audience will join us again for another webinar in the future.
Thanks.
Thank you so much, Pam.
Thank you very much.
Thank you.
It was a pleasure.